the assistance of psychological professionals, psychiatrists and psychologists, would be invaluable, and it may not have been done before, and this is kind of war we've never really fought before.
Well, does that fit your definition of the role of medical personnel?
No, it doesn't. And most medical, if not all medical personnel who are clinicians, aren't trained to do these kinds of assessments.
Brigadier General Stephen
There are very good professionals.
Sankis.
The FBI is excellent. They have people that's all they do. They do that all the time. They have great experience, and they know how to conduct interrogations. But you don't bring practitioners, people who treat patients, into this arena, particularly since more often than not they're young doctors just out of training, and it's not at all what they've up to that point had as part of their experience.
Your answer.
Well, I think if the problem is that they are not that experienced, then perhaps we should be looking, or the military should be looking for more experienced practitioners to be part of this. But I think in terms of the overall use of medical professionals, certainly there's nothing legally problematic with that. Whether there is an ethical problem for the medical profession is something obviously the medical profession is going to need to wrestle with.
Is this about policies? I mean, is this about the medical practice, or is this about the policies of the U.S. government and intelligence? That is, clearly this is about enhanced interrogation versus torture, the debate that we've had in this country for a number of years.
So it's about the policies and about enhanced interrogations and the involvement of clinicians in the practices, and we all adamantly oppose torture and abusive treatment of detainees. The practice issue also comes into play, because taking a young practitioner and then putting them in a situation where they're not acting as a doctor, and then expecting them at another point to put that aside is really impractical. You know, that doctors, we in the military, subscribe to a role. In fact, all the professionals, all the various branches and corps, we identify with our branch, with our professional training. And it's that we use to do our job the best that we can and to accomplish the mission.
And what would you have doctors do when put in these situations?
I'd have them refuse. I mean, it clearly violates our ethical principles. It clearly violates the principles of do no harm. And I think that they would be supported, particularly by these kinds of doctors and other experts on this panel, that they should not be involved in this.
Can doctors refuse? Should they refuse?
Well, I think it's more complicated than that, in the sense of when you say do no harm, it may well be that having a physician involved is the very thing that you need so that you do not do harm. Whether a doctor can refuse or not, obviously a doctor in private practice or a private contractor clearly can. Military doctors, of course, it is more complicated. They are in the military. They, of course, can refuse unlawful orders. But what is and isn't an unlawful order, obviously, is something that is often not clear, especially in areas like this, where we have, over the last 10 years, basically been learning as we go along.
Let me ask you briefly, what's your answer to my broader question about how this fits into the larger debate here about it?
Oh, I think this is very much about the policies. I mean, I certainly, I believe the Open Society Institute, one of the sponsors of the report, has been one of the great opponents of not just enhanced interrogations, but pretty much all of the interrogations that have gone on at Guantanamo and Guantanamo itself. But the truth is, if all the physicians were removed, interrogations would not stop. The United States is at war. It has a right to interrogate. What would happen is the interrogations would be less safe for everybody.
All right. We do have to leave it there. Stephen Zanakis, Lee Casey. Thank you both very much.
Thank you.
Less safe.